For today's video, I had the pleasure of speaking with Mr. Tom Clark, who did a great job in addressing the most commonly asked questions we receive from clients on the topics of Social Security retirement benefits and Medicare. Now, Tom does a great job describing his background with the Social Security Administration and his expertise. And so I'll let him speak for himself. Without further ado, hope you enjoy this conversation with Tom Clark. Well, all right, Tom, appreciate you taking the time to join us here this afternoon.
Oh, glad to be here.
Good. Yeah, and for people's reference who are going to be watching this, we're doing this on a Friday afternoon, so I figured there's no better way to kick off the weekend than doing a little Social Security Medicare.
That's right. What better way?
Well,
nice sunny Friday afternoon.
Beautiful, yeah. So, before we jump in, I know we want to do kind of a rapid fire of the questions we most commonly receive from our clients. But I thought it'd be helpful if you could just share about your background. How'd you get into this and what your story is?
Okay, well, I worked 33 years for Social Security, and during most of that time, I was a public affairs specialist. This means a big part of the job was doing presentations to all sorts and sizes of groups about Social Security and Medicare. I actually made more than 6,000 presentations when I worked at Social Security, most of them by the history of the agency. And then a few years ago, as baby boomers started reaching retirement age, which pretty much doubled their workload, or the staff has actually gone down since I retired, pretty much almost all the resources have to go to getting people paid because the numbers are just incredible. About 14,000 people file for Social Security retirement benefits every day. About 8,000 file every day for disability because an aging society means more disability applications. That doesn't count the widow's benefits, the children's survivors benefits, the tens of thousands of Social Security cards they issue every day because this is a big country. So they quit doing these. And I became eligible to retire right when that happened. To retire and just started doing the same thing. Done about another 1,000 presentations all around the country since then. So
you've done this a time or two, I guess.
A few times, that's right.
So did I hear that correctly? I know this will come as a huge shocker to our audience. So we've got more demand than ever for Social Security Administration services and less staff than we've had.
And less staff. That's right. Yeah.
Yep.
And so they are very, very busy. They're very busy down there these days, working a lot of overtime, just trying to get everybody paid.
So nowadays you're doing kind of what you had done previously with them, but just kind of on the private sector.
That's right. Just as a self-employed person, I get to do the part of the job I like the best. I don't have to do the rest of it now. So it's pretty nice.
Nice. You can pick and choose. And for folks who are watching, we've used Tom as a resource on a number of occasions here over the recent years here, just on client cases and unique situations that come up. So certainly appreciate your knowledge.
Yeah, and I've been talking to a few clients on seminars since way before I retired from Social Security. I think first seminars I did for y'all was in 1999. I think I was thinking back on that.
Yep. Well, all right, let's jump right in here. So I guess we want to try and provide some perspective for maybe someone who's coming on to retirement or maybe already retired and kind of get at this. So what we did, we polled the team and asked, hey guys, what are the most common questions you get on retirement benefits and Medicare? And so that is the questions we'll cover today is kind of a result of that. Thought I'd just kind of jump off with a common question, someone coming on to wanting to apply for benefits, retirement benefits, that is just logistical questions of like, where do I go? What do I do? What information do I need? Like, what's the lead time? You can maybe speak to that.
Yeah, well, you can file 3 months ahead of time, 3 months ahead of when you want your benefits to start. So if somebody was going to turn 62, for example, in August, and they wanted to start the benefits at 62, they could apply in May. For most people, in most cases, online is probably the best way to file. You can apply for virtually all benefits on the website, which is socialsecurity.gov, socialsecurity.gov. And the one benefit you can apply for online, though, are widows and widowers benefits. And widows and widowers have some options that don't apply if your spouse is living. For example, a widow who's worked herself, she could take one benefit, say her own was lower than the widow, she could take her own benefit set 62 reduced for being younger than her full retirement age. And we see that till she reaches full retirement age and switch over to unreduced widow's benefits for the rest of her life, or vice versa. If her own was higher, she take the widow's first. We see that check while letting hers keep growing, and her own will keep growing until 70, actually, if she delayed it till then. And so Social Security doesn't expect everybody to know all that. And so that's why they don't let somebody apply for widows or widowers online, because they want to talk to the person first to give them all their options before they make that decision. But the other benefits, retirement, spousal, disability, they can apply for those on the website.
Okay, so it's only going to be a limited number of special cases where you would really not want to go straight to the website.
Yeah, and so if somebody does need to apply for widows or widowers, they don't have to go into the office. They can do it by phone. If they just call Social Security's toll-free number, they'll set an appointment for their local office to call them and take that application over the phone.
Okay, very good. Okay, so let's say normal case scenario, right? You go in, you set up your account online, and then you're going to go apply up to 3 months before you want to receive that first check. What kind of stuff are they going to ask you? I mean, should you gather some things, or is that?
Well, you might want to gather. They're going to ask you thing that you might not know, particularly if you're the husband, maybe is the date of marriage. They're going to ask the wife. The wife, she's going to know that. The husband may not remember that. So, but anyway, they're going to ask. They got things that you already know: date of marriage. I mean, date of birth, place of birth. But they will best ask all the marriage information, including dates when a marriage began, where did it, if it did end, and how it ended. And the reason they ask that information is because they cannot be finished with an application until they make sure they paid you as the applicant the most you're due on your record, or spouse's or former spouse's record. Or they have to also check if somebody else, the spouse, might be able to receive on your record. So they ask that information because they don't want to miss somebody who might be eligible for benefits or higher benefits.
So I tell you, that's another common topic we get, which you brought up, which is spousal benefits. So when you come across people who are, approaching retirement, or we meet with them and they just say, maybe the spouse has been a homemaker and they just say, well, I don't have Social Security. I'm not going to get a Social Security benefit. So maybe if someone has not received the good news, maybe you could, break the good news to them today.
Yeah. They do pay spouses benefits to receive a benefit on your spouse's record, a living spouse's record. The wage earner, the one who worked, has to be drawing their own Social Security benefits. Then you as a spouse have to be at least 62, and you have to not be entitled to more based on your own work. So if you had a homemaker who never worked at all, then once her husband's drawn his checks and she's at least 62, she could draw an additional check on his record. His check stays the same either way, so this is an additional money amount paid to her as the spouse. Now, if she did work, if her own was higher, then she'd just draw that higher amount she's earned based on her own work. And a spousal benefit, when the wage earner's living, it's based on half of that wage earner's full retirement age amount. So, for example, if we had a wife who never worked outside the home, so she doesn't qualify for her own Social Security, if she waited till her own full retirement age, she would get half of her husband's full retirement age amount. Even if he took it at 62, it would still be half of his full amount. But if she takes it before her full retirement age, that half would be reduced for each month she's younger than that age. And one thing I get this question often. People say, well, I can take my own at 62 and then switch over, and when my husband's not drawing benefits yet. So I'll take my own low benefit at 62. And then when he starts drawing his, I'll switch over and draw half of his full amount because I'll be full retirement age then. And it actually doesn't work that way. They compute her own benefit and the spouse's separately and add them together. So if she takes a reduced benefit at 62 on her own, and her husband starts drawing later, she wouldn't go up to exactly half of his full amount. She'd still have some reduction for taking that one early.
Still started early, right? Right.
Yeah. And that doesn't mean she shouldn't take it early, but it's just don't expect it to go up to exactly half if she does take her own before then.
So let's say you're one of these folks, right, who has primarily worked in the home, but maybe does have an earnings history of your own, and you're not really sure which one's higher. You mentioned earlier, I think, during the application process that the Social Security Administration will kind of do their due diligence to make sure the highest benefit that you're eligible for will be paid
Right.
out. So is there any burden on the actual recipient of the benefits to do that?
No, not really. If your spouse is living, then when you apply on your own record, you're automatically applying on their record and vice versa.
Okay.
So if your spouse is living and drawing their Social Security, I should say, then when you apply on your own record, you automatically apply on their record too. If your spouse is living, you have to take your own Social Security first. If that's more than you can draw on your spouse's record, you just draw that higher amount based on your own work. If it's not as much, then you draw your own first and they add the difference from the spouse's record to that amount you're on your own. But Social Security is going to do that automatically.
So if you begin drawing on your own, and then at a later date, your spouse or ex-spouse begins their benefit, is there an automatic process where they'll recompute which one's higher and adjust it?
They will. That's what again, once again, why they ask that marriage information of every applicant. So if this person started drawing on their own, say at 62, and she hasn't remarried, for example, and her ex-husband started drawing later, they would ask him about his marriages. They would then contact her, or at least look up her record to see if she's doing anything else on his record. If she was, they'd contact her to file that application.
Okay, very good. Yeah, common scenarios that we've seen. So
yeah, and I've never actually seen Social Security miss one of those. If they work real hard to find that one. So as long as they can locate the person, if they're doing any benefits, they will take that application. I've never seen them fail to do that. Now, it could be they can't locate that person. Maybe they moved out of the country 30 years ago or something. But,
right.
But if they can locate them, they do try and make sure they try to get that application.
So the remaining few, those workers there at the Social Security, right? Even though they're short staffed, they're doing their darndest to get it.
They are. It is a very good agency because somebody who works there, if they don't like people, they won't last long, because what they're going to do all day, every day is talking to people. So
sure.
So they attract some very good employees.
Well, so let's talk kind of at the other end of the spectrum. So that was the spousal benefits conversation. Now, toward the latter years, right, there's another concept that comes into place, which is survivor benefits, right? So could you speak to it? Is that the same thing? Are we talking about the same thing, spousal and survivor? How should people?
No, actually, they are different. As I said, when your spouse is living, the benefits based on half. Widows or widowers benefits, because all these benefits are exactly the same for men or women. Most people tend to just say widows benefits for survivors because it's usually widows. But every time somebody says widows, you could substitute widowers because it's exactly the same for men or women.
Sure.
But unlike a spouse benefit, which is based on half, a widow's benefit is based on the full amount of the deceased spouse's check, or based on their full unreduced amount if they died before they ever drew their own Social Security. So I can use this as an example because this is like the most common situation with widow's benefits. Let's say we have a husband and a wife, both receiving their Social Security. Say the husband's check is $2,000 a month, the wife's is $1,400. If he passes away before her, if she's at her full retirement age or older, her check would go up to exactly what his was. So this example, her check would go up to $2,000 a month. If she was younger than full retirement age when he died, her check would go up again to that higher amount, but reduced a little bit for each month she's younger than full retirement age. And widows and widowers will start drawing benefits as early as age 60 on their deceased spouse records. So they can draw a couple years earlier. Also, in general, and this doesn't apply to every couple or every person, in general, I think that for a person's own retirement benefits, a lot of people take it too early. A lot of people should wait longer to take it, not take a reduced benefit, because we're just living longer and longer these days. However, the reduction for taking the benefit early for widow's benefits is a lot less per month than it is on your own.
Oh,
so
great.
Yeah. So I would never, without looking at the numbers, say that somebody always ought to take a reduced widow's benefit, because you need to look at the numbers in their own. But it's not as big a deal. If a widow wants to go ahead and start at 60, for example, they would get 71.5% of what they get if they waited till full retirement age, which say that's 67. That's not a big reduction for 7 years of drawn checks.
Sure.
So it's a different situation for a widow. For example, if say the widow was 60 and she didn't have much Social Security on her own, so she's going to draw more on her spouse's record. If she didn't take them at 60, she was retired then, say she didn't take them, waited until 67, it would take her about 18 years with a higher check to recover those 7 years of checks she passed up.
Wow. That's
Now,
a long break even.
Yeah, that is a so that's a lot different because it's 12 years on your own record between taking it, and that's different. 18 to me is a lot different than 12 as far as deciding when to take it at that age. Now, of course, if she has worked herself before she makes that decision, she'd want to look at all those options. Since the widow does have those options we talked about earlier, where she can take one benefit and delay the other. She shouldn't just take it at 60 no matter what. If she's worked quite enough herself to be doing a substantial check on her own, she'd want to check all those options.
Sure. So it really is. I mean, case in point of it, it really is just a case by case evaluation, right?
It really is just looking at Social Security in isolation. Even it's a case by case evaluation. But then for a financial planner such as y'all, it's other things enter into that. You can't really make that decision about when to take the benefit in isolation of your other financial circumstances. Because in some cases, for some people, it might be wise to take it early. For a lot of people, it's going to be wise to take it later. But for example, let's say that somebody turned 62 and had to retire in 2009 during the Great Recession. Well, it might have made sense for that person to go ahead and take a reduced Social Security check so you'd have to withdraw money from their 401k while it was down 50%. So there's a lot of so in some cases, and that it's right to take an early benefit. When I say I think most people should wait, that's just a general statement, actually.
Yeah, absolutely. And then all of a sudden you factor in maybe it's a married couple and there's two different benefits we're thinking about optimizing. Right. There's portfolio assets, varying compositions of tax status, and then depending on when they retire, it really is it's a complicated I guess it's a good opportunity for us to earn our salt.
That's true. Because I've seen a lot of cases where it makes sense for the one with the higher benefit to wait as long as possible up to 70, while the one with the lower benefit takes it early, because that way you maximize the check the last survivor will draw, but they're also drawing a benefit in the meantime. And I found that also that both financially and psychologically, it makes it easier for a couple to wait for 70 for one of them if they actually draw a check on the other's record in the meantime. They actually get some Social Security money in the meantime.
Sure.
Just psychologically, it makes it easier for the other to wait till 70.
Right. It's kind of the bird in hand.
Yeah.
You kind of check that box, but you also you're deferring that benefit. Yeah.
Right. Absolutely.
Yep. So from our perspective, there's a lot of times what we run into, just maybe people who are watching and thinking like, what are some of those other considerations? We'll run into the situation where we'll do a tax projection out to their required minimum distribution age at 72, and they've got a tax problem on the horizon, meaning their retirement portfolio assets are projected to have grown so much that they're going to be forced to take all this taxable income in excess of really what they need. So from that standpoint, it makes sense to spend more from their retirement accounts earlier on, or do some Roth conversion strategies and defer Social Security to try and mitigate that. So that could come into play.
Absolutely. And of course, that's something I do. That's something you do, because I just do Social Security and Medicare only, but that makes a lot of sense. Also, at full retirement age, a person can draw their benefits and keep on working. But if they wait till 70, the benefits grow on their own record, their own retirement benefits grow at 8% a year. Well, 8% guaranteed return that then goes up with inflation, with cost of living raises the rest of your life. It's really hard to pass up if you don't need the money right then. And since pensions have pretty much disappeared, this is their only guaranteed lifetime income. To me, it makes a lot of sense to maximize your only guaranteed lifetime income, at least for the higher wage earner of the couple.
Right. Talking about a married couple. Yeah. So it's kind of like that higher wage earner. You kind of keep that's your ace in the hole, right?
Yeah.
Market downturn, don't want to spend from the portfolio, you play it, right? I mean,
right. And as long as people are living, my concern is a lot of people, even if they saved really well, a lot of people may outlive their savings, because it's hard to have your savings last for 30, 35 years, but that's how long people are living these days. My mother turned 90 in December, and she's doing great. She lives in a retirement community in Oklahoma City. She helps old people out, who are younger than her mostly.
Right.
But she hasn't slowed down. She hasn't slowed down at all the last 15 years. And so she's pretty close to outliving her savings because, you know, they saved well, but they had fun in retirement too. So she's pretty close to that. But it'd be nice if she had waited a little longer to take her check, to have a little higher check coming in right now.
Sure. Oh, absolutely. Well, so, it brings up an interesting point. I know we wanted to cover this at some point, and because it's a question we get a lot of is, these life expectancies continue to expand. And then you start looking at the fiscal, I guess, situation of the administration itself. So what is the outlook? I mean, if I'm my age, right, looking out to my age, 90, I mean, what's the outlook? What are the analysts saying as far as the funding capability?
Well, the worst case scenario, if the economy were to be stagnant, which it's not stagnant now, of course, but if the economy were to stay like it was 2 years ago when the pandemic first hit and things shut down, if the economy stayed that bad forever, there's enough money to pay all the promised benefits for about the next 11, 12 years, depending on how you look at it. At which point there'd still be a lot of money coming in, just not enough to pay the promised benefits. People theoretically would draw about 80% of what they were promised. But I'll leave it to Congress to decide how to take care of the finances. It's not going to happen. They're not going to cut everybody's benefits by 20%. Social Security is not going to go away for so many reasons. But what people don't realize is if Social Security went away, it would not just affect the people on Social Security. Social Security money gets spent. Social Security pays over $6 billion a month in benefits just in the state of Texas. $6 billion.
Ah, I like that stat.
Yeah, now nobody has a payroll in the state of Texas anywhere near that, right?
Goodness.
Think how hard they would fight. The state would fight to keep a company that had a $10 million a month payroll to keep it in the state, right? This is $6 billion, okay? And that money gets spent. Almost every dollar gets spent because if you're 80 years old, you are no longer saving for retirement. You spend that check that's coming next month and the next month. Well, how many paychecks in the state of Texas that $6 billion turned into?
Right.
Yep. So if those checks stopped, how many people are out of work? I mean, it would be worse than the Great Depression. I ask people that ask me this kind of question to say, every time you go to a restaurant now, start looking around and see how many people are obviously drawing Social Security.
Right.
And most of them wouldn't be in that restaurant because for 2/3 of people over 65, Social Security is more than half their income. So those people wouldn't be there. Well, all those people, the owner of that restaurant, all those people working there, more than likely they would be out of business. They wouldn't have a job. Next time you fly, I started doing this because I fly around speaking at seminars all the time. So I started doing this because it's always bored, right? So I started making a point of looking around and counting all the people waiting for the plane that I was waiting for, who are obviously drawing Social Security. It's usually 40 to 50%. So if you work for an airline, about half your paycheck is coming directly from Social Security. If those checks were to stop, you don't have a job. So it's the economic, it would be economic catastrophe, and Congress isn't going to let those checks stop and have that happen.
So it sounds like it's, the sheer amount of buy-in, societal buy-in on the program is just, right. It almost ensures
absolutely
its survival.
The interesting thing is, ever since Social Security started, polls have shown in every age group, more people support Social Security than any other government program, including defending the country.
Wow.
So once again, Congress knows that. And that's really why, it's so popular, they're afraid to make any changes in it. We like it the way it is. Our elected officials know they like it the way it is. And that's why there's lots of things they can do to take care of any funding problem, but they're kind of afraid to do it ahead of time till it's a crisis because they're afraid people won't like it.
Right.
And so they'll wait till it's closer and it's a crisis, but there's a lot of things they can do.
So what are some of those things? Maybe some people are saying, well, hey, what if we do have a stagnant economy? So what are some of those levers they would pull?
Well, one of the things that would solve a big part of the problem and actually push out any reckoning way off into the future would be to eliminate the tax cap on Social Security taxes. Right now, somebody stops paying this year Social Security taxes once they earn $147,000. If you just did away with that, there's one option is just tax for Social Security on somebody's full income. That takes care of a big, huge part of the problem right there. And others have said, well, and this deal takes care of a lot of, some have said, well, go ahead and stop taxing at 147,000 because, especially that's just the father working, that's still a middle class family, right? But start taxing again, Social Security tax when somebody makes something like 300,000 and tax the rest of it above that. So, that's a couple of options that take care of a lot of it right then. And I really think they'll probably take care of most of it on the income side and not cut too much on the benefit side myself, because I just can't see where they can hardly cut benefits side right now. Most people don't retire in luxury, and you do, and so it's the Social Security check. Really, what Social Security makes a difference for most people is that they're able to retire with dignity rather than having to scrounge for money the rest of their life. And so I don't really see them cutting much. It's my opinion. I don't see them cutting much on the benefit side. I think they'll solve most of the problem from the income side.
So it sounds like, in your view, really that wage base itself would be the first thing that they would turn to, either raising it or somehow, changing the calculation.
That would be my guess. Would be the first thing they'll do. Yeah.
Because you look around just countrywide and go, okay, think about the amount of people making over, currently 147,000, and go, even if they just raise that by however much percentage, right? And then imagine the impact it would have for the funding status.
Oh yeah, right. Yeah. So that's my guess is that's what they'll do first. And there are, financially, it's not that huge a problem. I don't think. Politically, it's a big problem because it's such a popular program that no one party will make a big change on their own. It's going to have to be bipartisan because it's just too risky for a party to make that kind of change on their own, because if there's a problem with it, they get blamed. And so any big change Social Security is always bipartisan.
Oh yeah, and to your point, it's likely going to have to come down to the wire, right? Because
I think it will. I think it will. Yeah. But I'm not concerned at all that it's not going to happen. I'm not concerned at all about that. It's kind of interesting. People would always talk to me. I work at Social Security, and the presidency changed from one party to another. They'd say, "How's that affect you?" If I didn't ever read the paper, I would never know which party was in charge working at Social Security. It never made a difference for Social Security which party was in charge, because both parties have always supported it, very much. So,
and that may surprise people to hear. It may really surprise people to hear that.
I think it does, but if you didn't read the paper and you worked at Social Security, you would never notice the difference when one party was in charge or the other was in charge.
Well, so no, I appreciate you addressing that. That's a perennial favorite in terms of questions like, okay, I'm planning on this benefit. I'm about to retire. Can I really trust this? So it helps to hear from.
Plus the human cost would be tremendous. Just in the DFW area, 250,000 people drawing Social Security have no other income, or it's at least 90% of their income. And so you got to, if those checks didn't go out, you'd have an additional 250,000 people potentially homeless. But they wouldn't become homeless. You know why they wouldn't become homeless? Because they'd move in with you.
There you go. So all of a sudden you got multiple, voter bases lobbying.
Oh, that's right. When people tell me Social Security is going to go away, I say, well, you better not downsize at retirement then, because you're going to need an extra bedroom for mom and one for grandma too.
That's great. That'll get your attention.
Yeah.
Well, hey, I wanted to turn to, I think you mentioned earlier is, retiring at full retirement or thereafter. There's really no limitation on earned income as far as a penalty.
Right.
We do frequently get the situation of an early retirement, right? Retiring prior to full retirement age. Could you speak to some of the considerations that go into that from the standpoint of having earned income or a job of some sort?
Yeah, if somebody is younger than full retirement age, then there's a limit how much they can make from work without affecting their benefits. All that counts toward this limit is what they're actually working for. It's that there's only two kinds of earned income. It's wages from an employer you're working for right then, or if you were self-employed, your net profit. That's all that counts toward this limit. So pensions, interest, dividends, royalties, distributions from IRAs or 401ks, none of that counts toward the limit. The limit goes up with inflation, but this year it's $19,560. $19,560. Let's say we have a 63-year-old drawing his Social Security, decides he wants to go take a part-time job. If he does not earn more than 19,560 from that job this year, his benefits are not affected at all. If he earns above that, for every $2 he earns above that limit, $1 is withheld from his benefits. So let's say a 63-year-old made 21,560 from his job, exactly $2,000 above the limit. They withhold $1 in benefits for every two he's above the limit. So if he made 2,000 above, they withhold $1,000 from his checks, pay the rest of benefits for the year. No matter when you start drawing your benefits, once you reach full retirement age, no limit from then on. There's a special rule for the first year of retirement. The first year of retirement, a person can receive a check for each month they're not working, no matter how much they made before they retired. So let's say somebody's 62 this year, they're going to work January through September 30th and then retire, not work October, November, December. Since that's the first year of retirement, they can draw a check for October, November, December, the months they're not working, no matter how much they made before they retired that year. So it's a special rule that lets somebody retire during the year without penalizing them for the work they've already done before retirement. It only applies to that 1 year though. That person went back to work the next year and earned over the limit, they just withhold what they needed to. It wouldn't matter when they worked or when they didn't.
Okay, so let's say I'm a 63-year-old. This is not my first year of retirement, and I already know I'm drawing my retirement benefit.
Okay.
And let's say I already know I'm on track to earn that 21,560.
Okay,
I'm going to be
okay.
$2,000 over by the end of the year. What should I expect in terms of my monthly check? Like, is the Social Security Administration going to detect the fact that I exceeded and automatically reduce it? How does that mechanism work?
No, he'd have to. Social Security has no idea what he's doing this year. So if he doesn't want to be overpaid, he needs to call Social Security up and say, I'm going to earn this much this year over the limit. It's best to be a little bit high because if he gets a Christmas bonus, maybe he won't automatically be overpaid. They'll withhold based on what he says. Estimate a little high. They'll withhold based on that. What they don't reduce the monthly check. They withhold full check amounts till they withhold how much they need to, then pay them the rest of the full checks for the rest of the year. So they'd stop his checks for a month or two if he's only $2,000 or $3,000 above the limit. They stop his checks for a month or two, depending on his benefit amount, start his checks back up. And then at the end of the year, when his W-2 came to Social Security, if he estimated too low, they'd owe him a little more money. If he estimated too high, they'd owe him some money. If he made more than he estimated, he'd owe a little bit more, which they withhold from his checks, but they don't charge interest, so it's not a big deal. If he didn't tell them at all, if he made over the limit but didn't call them to tell them, then when the W-2 came, they just sent him a letter saying you're overpaid. And if you don't do anything at all, we'll just hold out your checks. If you want to pay a little at a time, contact us and they can do it. Once again, they don't charge interest, so kind of like a
okay. So it's kind of like a tax return process of like after the fact you settle up, right?
Right. That's right. Yeah. Right. And that's why most people would rather Social Security owe them at the end of the year than have to pay. Just like most people, it's the same amount of money. Sure. But most people still like get a refund rather than write a check to IRS. Kind of the same thing with Social Security. That's why they always encourage people to estimate a little high, because they're just happier at the end of the year if Social Security owes them money rather than them owing Social Security money. Oh,
absolutely. But again, as you mentioned, in the first year of you were drawing those benefits, there's that safe harbor of you can earn well above. You can earn. There's no cap, right, in the months preceding that first check.
That's right. That's right. And also, there's a special rule for the year they reach full retirement age. Beginning with the month they reach full retirement age, from then on, there's no limit on their earnings. They can make as much as they want to, still draw their checks. But in that calendar year in which they reach full retirement age, in the months before they reach that age, they're allowed to make a higher amount without affecting the benefits, which this year is $51,960. So let's say somebody is reaching their full retirement age in June of this year. Well, June on, it doesn't matter how much they earn, it won't affect the benefits. But if they weren't going to earn more than $51,960 January through May, they could receive those checks too. Now, they would be reduced a little bit for each month they're under full retirement age, so there'll be a little bit of reduction there, but their earnings wouldn't affect them if they weren't going to make more than $51,960 in the months before they reach that age. So I encourage people who think they may want to keep working but take the benefits at full retirement age, I encourage them to contact Social Security in October of the year before then to see if they tell Social Security what they're planning to do, get their options to see if they want to go ahead and start the checkup in January, maybe. Because an application before full retirement age for benefits is not retroactive. So this person could have drawn checks starting January that year, but they waited to February to file. February is the first check they'd receive. They couldn't go back and pay them the January check. So I encourage them to check it out late in the year before they reach full retirement age to see if they want to do that.
Okay. So let's say my full retirement age hits in March.
Yeah.
So if I'm already drawing prior to that, could you earn up to that 51,000 figure that you mentioned in January, in those couple months?
In January and February, yeah. If you didn't make more than 51,960, you'd be able to draw those checks too. Yeah.
Yeah. And so that's a common occurrence where, let's say maybe I retire end of year, but I got a big payout, right? It's a PTO, a bunch of stuff that pays out into the next year. So that could be a situation where that would apply. It
could be. And also those earnings may not count toward the limit anyway. Earnings paid after retirement are considered earned the last month they worked. So let's say somebody retired in December and they didn't work anymore after December 30th for the employer. They actually retired. But they told Social Security, say this person is 63, so not yet full retirement age. They retired in December. They filed for the Social Security to start in January after they retired. They told Social Security they're not going to earn more than the limit. But then come in January, they get all their accrued vacation pay and maybe some sick pay and all that stuff. And it adds up to $30,000. Well, what's going to happen that Social Security doesn't know that. And so the computer's going to send a letter when that W-2 comes saying, you said you weren't going to earn more than $19,560. We show you earned $30,000. If that's correct, you owe us some money back. However, it gives you things like if this was paid for previous years, let us know. So what they do is they'd contact Social Security and say, that was paid in 2023, but I earned it in 2022. And they would get a letter from their employer showing that money was earned in previous years and wouldn't count toward that earnings limit. It's still taxable for FICA tax, but it wouldn't count toward that earnings limit for that year.
Oh, that's a helpful tip to know, though, right? So there's
just kind of expect that if you retire late in the year from a big corporation that has benefits like that, expect that to happen to you, basically. Just be ready. Just be ready. Some people actually will go ahead and get that letter from the employer after everything's paid out, showing that this was all earned in previous years, so they're all ready to Social Security when that letter comes.
So there's another topic. We're going to kind of switch gears here and talk about Medicare. And I want to return to this idea of the windfall as pertains to Medicare. But just turning our attention here to Medicare, let's kind of talk again on the front end of enrollment periods, right? So if someone's coming on to their 65th birthday, or maybe they're considering working beyond that and staying on group benefits, what are the different options available for enrolling in Medicare?
And first, the most important thing for anybody to remember from what I talked today, we're going to say right now, that is when Medicare is your primary payer, you've got to have Medicare A and B in place at a minimum. Medicare A is hospital insurance, Part B is doctors and outpatient. Once Medicare is the primary payer, you have to have Medicare A and B in place, because once Medicare is primary, nobody else will pay anything Medicare pay for except Medicare. So the only time Medicare is not primary, the only time Medicare doesn't pay first, is if the person at age 65 is covered for health insurance by their or their spouse's active employment for an employer of 20 or more employees. So somebody, when they turn 65, is working for an employer that has 20 or more employees, and they're covered by that employer's health insurance as an active employee, then the employer's insurance has to pay first while that person's still working. Medicare pays second. That's the only time a person does not need Medicare A and B in place, or works for the spouse too. Say this person's working for an employer of 20 or more employees. They got the active employee's health insurance from that employer. They have their spouse on it. The spouse turns 65. That's the same as them working down there. Medicare secondary for the spouse until that worker retires. They can wait and get their Part B right away because Medicare is secondary. But in every other situation, if they're retired from where they have their health insurance, if they're self-employed, turning 65, if they're not covered by health insurance at all, if they're on COBRA or retirees health insurance from the employer, all those situations, Medicare is going to pay first. They got to have Medicare A and B in place.
And so they need to take action and get enrolled in both of those.
Right. Yeah, right. And there's only one time Medicare enrollment is automatic. The only time a person doesn't actually need to enroll in Medicare is if they're already drawing Social Security before age 65. If somebody's already drawn Social Security before age 65, in that one situation, Social Security is going to send them their Medicare card automatically. They'll automatically enroll them in Part A and Part B. If they just keep the card, they're sent to automatically have Part A and Part B. But in every situation, they got to apply for Medicare. So let's take somebody who needs to apply at 65. Say they're retired, so Medicare is going to pay first, but they want to wait till 70 to start taking their Social Security. So they're not drawing Social Security yet, but they're retired, so Medicare is going to be primary. Then they need to apply for Medicare because they can apply for Medicare only without applying for Social Security. And they would need to apply for Medicare during something called the initial enrollment period. Technically, that's 7 months long. The 3 months before they turn 65, the month they turn 65, the 3 months after. However, in my opinion, it's only 3 months long because I don't want anybody to have 1 second's gap in coverage. If Medicare is going to be primary for this person because they're retired but not drawing Social Security. So Medicare is primary, they won't be enrolled automatically. Let's say they turn 65 this month, April. As long as they enrolled in Medicare by the end of March, their Part B would start April 1st, the month they turn 65, there would not be a gap in coverage. But that person waited till April, the month they turn 65, Part B wouldn't start till May. For a whole month, they have no coverage for doctor bills. I'd be afraid to get out of bed if that was me. If they wait till the next month and that 7-month period gets even worse. So if somebody needs to enroll in Medicare during that initial enrollment period when they turn 65, they need to be sure to do it by the end of the month before they turn 65. So there won't be a gap in coverage.
So really that's the priority. So initial enrollment period, while you do have that time period, that 7-month time period you alluded to, saying really the priority is to get that done sooner rather than later.
That's right. In my opinion, it's really only 3 months long because I don't want anybody to not be covered for doctor bills. And then one other little thing that I always mention, because this affects about 1 out of 30 people. And these are people whose birthday is on the 1st of a month. There's a legal principle out there that, as far as I know, all laws follow. It just doesn't matter for most laws, but it matters a lot for Social Security and particularly for Medicare. And that principle is a person actually attains an age the day before their birthday. So if somebody's 65th birthday was April 1st, legally they turn 65 March 31st. The Medicare is effective March 1st. If they needed to enroll that initial enrollment period, they needed to file by the end of February to not have a gap in coverage.
Oh, wow.
So if you're born on the 1st of a month, everything for Social Security and Medicare happens to you a month ahead of time.
Okay. Okay, so then let's look at the other case. Let's say you work beyond 65, 20 plus employees at your employer, and you're covered. So then when you come on to retirement, what happens?
Then you don't need to file for Part B, and probably shouldn't file for Part B when it's secondary. You get something called a special enrollment period when you retire. A time you can file for your Part B.
That sounds nice.
Right. You're special, yeah. You're special. So you can file for Part B, and you can pick up Part A anytime. So that's why we're talking about Part B here. You can file for Part B when you retire. Part B will start right away. There'll be no penalty. Now, once again, I disagree on how long this lasts. Because if somebody's 68, they didn't take Part B because they were covered by their employment for employing 20 more people. So Medicare is secondary. So they're retiring. And they go read the literature. It says you have 8 months. The special enrollment period is 8 months after you retire. Once again, I don't believe it's 8 months long. It is only 1 month long because nobody wants a gap in coverage. So that person was 69 years old when they finally decided to retire. They retire in April today. Medicare becomes their primary payer midnight May 1st, the month after retirement. They would have till the end of May to file for their Part B, have it retroactive back to May 1st, and no gap in coverage. But if they waited till the second month of that 8-month period to file for Part B wouldn't start until June. Once again, they'd have until July, they'd have 2 whole months without any coverage for doctor bills. So it's 1 month long, not 8 months long. Now, I'd encourage somebody in that situation to file for their Part B about 3 months before retirement. That gives Social Security time to get their new Medicare card to them by the time Medicare's primary. But I was doing a consultation with somebody a couple of weeks ago. He didn't know he was retired until he got to work that morning and found out he was retired. So somebody doesn't have 3 months warning.
Right.
Yeah. But, you know, maybe something changed their personal life, they had to retire sooner than they thought.
Right.
Then be sure and file if you work past 65 like that with Medicare secondary. Be sure and file for Part B at the very latest, the month after retirement, to not have a gap in coverage.
Sure. So maybe you can speak to this idea of the retroactive Medicare coverage.
Okay.
We run into it a couple times, particularly in the context of making HSA contributions.
Absolutely.
So those individuals who work beyond 65.
This involves Medicare Part A, which is the hospital inpatient insurance. Let's take somebody who doesn't have an HSA, for example. They've got regular health insurance, not a HSA policy. And an HSA, by the way, is a health savings account. To have an HSA, you have to have a high deductible health insurance policy. You get to put tax-free money in that HSA. It's not your flexible spending you lose at the end of the year. You don't lose this money. It's your actual health insurance says it's HSA. You keep that money. It's tax-free as long as you use it for medical bills in the future. Well, if somebody doesn't have an HSA and they're working past 65 for Medicare secondary, they might want to go ahead and take Medicare Part A as secondary coverage because it doesn't cost them anything. They have secondary coverage on their employer's insurance on an inpatient hospital stay. But if they have an HSA and Medicare secondary, they might not want to take Part A because the law says you cannot put tax-free money in an HSA once you are entitled to any part of Medicare. So somebody took Part A when Medicare was secondary like that, then if they have HSA, they couldn't put any more tax-free money in that HSA. Also, if somebody is 65 or over and receives a Social Security check, they automatically have Part A. They can't turn it down. So if somebody starts drawing their Social Security at full retirement age when there's no earnings limit, they will have Medicare Part A. Now, the Medicare law was written in 1965, and that was decades before the law that established HSAs. Sometimes when that happens, Congress doesn't think the laws together perfectly, and they did not in this case. The original Medicare law that still applies states that if someone does not take Medicare Part A at age 65, then when they do file for either it or Social Security later, they will be entitled to Medicare Part A 6 months retroactive before the month they applied for those benefits, or back to the month they turned 65 if that's less than 6 months in the past. So if somebody doesn't take Medicare Part A because Medicare secondary and they wanted to keep putting that money in the HSA, they need to start making those HSA contributions 6 months before the month they will apply for either Medicare Part A or Social Security, because it will be entitled to Part A 6 months retroactive. That's the law, and nobody can stop that from happening.
Yeah. Yeah. So you all of a sudden you want to run those HSA contributions right up to your retirement after age 65,
right?
Retroactive Part A coverage, and all of a sudden you're over contributed for
That's right. All of a sudden,
yeah.
if you don't do anything at all in about 2 years, IRS is going to send you a letter saying you owe some taxes back and some interest and penalties too.
Some growth, yeah. So that's a great distinction to make, because you spoke to the urgency of either the initial enrollment period, the special enrollment period is, hey, don't wait until that last month.
Right.
So that specifically is referring to a gap in coverage Part B.
Right.
And then Part A, the concern is the retroactive if you've got an HSA.
Basically the opposite. Yeah, that's right. That's right.
Right.
And if it's in the calendar year, say that somebody didn't know about that 6 months retroactive entitlement to Part A, if it's in the same calendar year, they can go just back that money out of the HSA before anything's reported to the IRS, no problem, right? But if it crosses over into the next calendar year, they've already filed their tax return for the previous year, and that 6 months crosses over there, they'll either have to file an amended tax return or just wait and pay the money when IRS sends them that letter,
Yep.
So
Yeah, we run into that from time to time to where someone's in the year of their eligibility for Medicare, and you have to calculate, because what they do is they prorate that HSA contribution limit for the
Right.
number of months, right? That you are eligible to do so.
Yeah. So that's something a lot of people don't know. And as you found, sometimes, they wish they did know. They get in trouble with it sometimes.
Oh, yeah. They learn after the fact.
Right.
Yeah.
It's a complicated world.
I wanted to, it is, yes. So I wanted to turn back to this idea of windfalls, right? So pertaining to Medicare premiums,
Okay.
from time to time, we'll have people come across a different kind of surprise, which is maybe they had a big income year, and all of a sudden, a couple years later, they find that their Medicare premiums go up on them.
Yeah. Okay. Yeah. First of all, let's just go kind of through the basics. Medicare Part B, the doctors and outpatient, it does have a monthly premium, and most people this year pay $170 a month for their Part B, $170. But that is only 1/4 the cost of Part B's monthly premium. The federal government pays the other 3/4. So every month somebody pays $170 for their Part B, the government pays $510 for their Part B. We pay 1/4 a month, they pay 3/4. But if somebody has income above $81,000 for an individual, I'm sorry, 91,000. Somebody has income above 91,000 for an individual or 182,000 for a couple, they don't get the full 75% subsidy from the government on that premium. So they pay more than 1/4 the cost. And how much more they pay depends on how much their income's above 91,000 for an individual or 182,000 for a couple. And this goes up with inflation, so that's what it is for this year. But this is the issue. Social Security does not know how much money somebody's making from all their income this year or even last year. So they have to base that higher premium on income 2 years before. So here in 2022, that higher premium is based on somebody's 2020 income. Next year it's on their 2020 income, 2021 income, and so on, always 2 years before. But if somebody's income has gone down in the last 2 years for certain reasons, two of them, the most common being retirement or becoming widowed. If somebody's income has gone down in the last 2 years because they retired or became widowed, they can ask, they base that premium on current income, not 2 years ago. So you have clients that have good jobs, they retire, they apply for their Social Security or their Medicare, and they're over 65. After they apply, they get this letter saying, based on your income 2 years ago, we have to charge this higher premium. But the income went down because of retirement, then they need to call Social Security and say, we retired, that our income's gone down, because just income going down doesn't qualify you not to have to pay that higher premium. It has to go down for certain reasons.
Sure.
There are a few other reasons that these are called life-changing events, by the way, life-changing events. There are a few other reasons. If your income goes down because of them, you don't have to pay the higher premium. They don't apply as often as retirement or becoming widowed, but they do list all those possible events on the letter they see. So you can look and see if something else might apply. But something like somebody say they had a rent house they've had for years and years, and they sell it and get a big capital gain for the year, they're going to be stuck with paying that higher premium for a year, 2 years after that. So.
Oh, wow. Well, so I guess that is one of the questions is, and you mentioned one of them, which is if you had a qualifying event and a reduction in income, there is some manner of recourse.
Right.
What if it's not that, right? What if you wake up 2 years later and go, oh, I didn't realize it, and all of a sudden my premiums are going up? Is there really anything you can do at that point?
Not if it's not one of those life-changing events. And I said capital gains. There might be sometimes where that could even qualify in certain reasons. Yet it has to be one of those events, though. And if it's a borderline region, think, well, this might not fall on this or not, this life-changing event, give it a try. All the Social Security tell you is no. But I found that the in a judgment call, the employees there pretty much tend to fall on the side of the applicant. And so if you think it might or might not fall in one of those life-changing events while your income went down, then give it a try. Can't hurt.
Yeah.
You know,
So you kind of add, there's kind of these different thresholds that we monitor in our client's taxable income. And,
yeah, yeah,
you just add that to the list, right? So you got the different tax bracket
right,
breakpoints. And then, of course,
right.
you got the IRMA amount. Yeah.
Right. And that actually, you'll pay a higher Part B premium if you're affected by that law. You also pay a higher Part D on prescription drug premium too. That's not really a big deal because those costs are a lot lower in the first place, but you still pay a higher one 2 years later on your Part
Starts
D
to add
also.
up. Yeah.
Yeah, right, right. So if it can be one of those reasons, I'll just list them here. I looked them up while we're talking.
Sure.
Income can go down because of marriage, I guess, because that is one of them, or divorce, become a widow, death of your spouse, retirement, which they call work stoppage here, work reduction. Let's say that your employer cut your hours and your income went down because of that. Loss of income producing property. And well, that's usually not just selling something. That's usually something like a tornado blew your shop away or something like that. But you can see that's very general. So if you think something might fit into that, give it a try. Loss of pension income, that would be very, very rare. Employer settlement payment, and I've never seen one of those apply. But anyway, if you have something that might fit in there, give it a try. All that Social Security can say is that's not going to be one of those. But as I said, they tend to fall. Right? Yeah, if it's a gray area, Social Security always tends to kind of fall on the side of the person.
So is it correct to assume that you'd have a 2-year window to reach out and go through that process before it actually would affect you?
Well, no, actually, you can't do it ahead of time, and this is why. You can't do it till you get that letter. This is why. The law prohibits federal agencies from having information about you that they don't need. Okay. Well, in general, all Social Security needs to know about your income is your earned income, because that's all that's covered by Social Security. That's all that enters into computing your benefit amounts. All they need to know about you is your wages or your self-employment income over your lifetime. They don't need to know about your investment income. And so Social Security doesn't have a right to that kind of information from IRS unless they need it. So what happens when somebody becomes entitled to Medicare, Part B, then Social Security's computer talks to IRS's computer to see if this person's income is above those figures 2 years ago. IRS's computer gives that information back to Social Security. If the income's above it 2 years ago, the computer prints out a letter and mails it. No Social Security employee ever sees that unless the person actually calls them up and say, "Oh, we meet one of these exceptions." And that's why I can't do it ahead of time, because Social Security has anything to do with it. They don't know what to do until you actually get that letter. So you can't do it ahead of time.
So that letter's generated, they let you know, and then you go, okay, wait a second.
Yeah.
I think I had a qualifying event, and you go through the process.
Right. So you can't do it ahead of time.
So now, kind of a related point, at a couple of times throughout our conversation, you mentioned, if this applies, you'll just call Social Security Administration, or you just reach out to them. So maybe for someone out there who's having a hard time getting someone on the phone, or having a hard time navigating that, are there any pro tips? As far as in touch with someone, getting stuff done?
Well, first of all, Social Security's 800 number was really busy before COVID. So you imagine the offices have just now reopened, by the way. You imagine what it's like once the offices had to shut down, right? They have reopened now, by the way, just yesterday. But
okay, great.
But this is the deal. Everybody calls that 800 number at exactly the same times. Okay. So what you want to do is call when everybody else isn't trying to call them. That phone number is answered from 7 a.m. to 7 p.m. Monday through Friday. No matter where you live in the country, in your own local time, it's answered from 7 a.m. to 7 p.m. Monday through Friday. But everybody wants to call on Mondays or in the middle of the day. So the best time to call that number is between 7 and 9 a.m. on a day other than Monday. Don't even worry about Monday. Between 7 and 9 a.m. the rest of the week. I can't promise you won't be on hold at all, but if you are, it won't be nearly as long as you might be in the middle of the day or on the Monday.
Interesting. Okay, so I guess you kind of got to.
Yeah, if you're not a morning person, the second best time is between 5 and 7 p.m. Monday through Friday. Okay. And this is the other deal. The later in the month and the later in the week, the less busy you are too. So Friday between 7 and 9 a.m. is going to be just about the least busy time of that week. Wow. The Friday in the last week of the month between 7 and 9 a.m. would be the least busy time for the whole month, basically.
Wow. Okay. So you kind of got, I guess you play the psychology of it as like you look at the target clientele that they're working with, right? So
Yeah,
they're maybe
that's
it's a
right.
generalization, right? Retirees sleeping in, and then they want to shut it down early afternoon and call it a day. So,
Yeah. And so
yeah,
between 10 and 2 is the busiest times of all. Never even try
yeah,
then, even on
yeah.
any day if you can help it. If you can help it. But they do some other things. They may be able to, you may be able to call you back. They may say, we can call this number back when we're free. You don't have to just sit there on hold. I just tell people though to, get your book or your Kindle out or something like that. Just, put your phone on so you don't, put your phone so the speaker work for you. When they come back on and
Mhm.
just read a book or something or a magazine.
But those target times, that's really helpful, right? And then later in the week, later in the month, early
And
morning, late
early morning or
afternoon.
late afternoon. Yeah, right.
Okay.
And
And then
that
as far as online or in person, is all that going to be initiated with the phone call, I guess?
well,
Um,
online, if you're doing something they can do on the website, you don't have to call them at all. If you're going to file for benefits, just file online. You don't have to worry about calling them.
sure. But as far
Yeah.
as setting up an appointment or
Yeah,
something like
if you
that,
want to
all
talk to them, say you're going to file for widow's benefits, you can't do that online. Then you call that toll free number, tell them you want to file. They'll set an appointment for your local office to call you and do the application over the phone. Social Security gets a lot of, all government agencies get a lot of criticism, and Social Security dealing with so many people gets a lot. But let me just tell you something that happened to show you how efficient this agency is.
hmm,
I know somebody applied for widow's benefits, a phone appointment, applied for widow's benefits on a Thursday afternoon. Okay. They were doing an immediate check. They were doing a check for the month they were applying for. And that was on a Thursday afternoon. 2 days later, this happened to check their bank account online on Saturday. That check was in the bank less than 2 days
hmm.
after they applied. They're so busy, they have no choice but to be efficient. If you're applying, if you're applying for retirement benefits, they're paperless. They are virtually paperless.
Uh,
If you
uh,
apply for retirement benefits on the phone, in most cases, that application is processed before you're able to hang that phone up when you're finished. They push a button at the end of that process and it's processed. And so they're incredibly efficient and very accurate too.
hmm.
Um, I hardly ever saw somebody's monthly benefits not computed correctly. Their accuracy rate is well above 99.5%. And most of the ones that aren't accurate is not Social Security's fault, but the person didn't call to tell them they're going to make over the limit. That's considered an error in Social Security's
Yeah,
deal. But
right.
Social Security can't help that, right? Most of the errors are actually that. So they really are a good agency. But they're incredibly busy right now. There's a bunch of us baby boomers.
Oh yeah. Oh yeah. Well, Tom, man, I really enjoy talking to you. Every time we talk, and I tell you, even when you and I talk privately, every
Right.
time we talk, I learn something new. So
Yeah,
we
enjoyed it.
really appreciate your expertise. I know people are going to benefit from this conversation.
Sure. I enjoyed it too. Yeah, great. Have a good
Well,
weekend.
so tell us what if people want to find you. I mean, how do people find you or contact you? What's your kind of current situation?
Okay. Well, I am self-employed. I do personal consultations. Of course, I do charge for those. And since everything's opening up, I'm traveling again. So I'm on the road almost all the time. The best way to contact me, somebody does want a personal consultation, is by email. And my email's simple. It's just spelled out Social Security Tom, my first name, Social Security Tom at gmail.com is my
Oh, there
email.
you go.
Yeah.
Yeah. Okay. So people can reach out, consultation, speaking event, all of the above.
Yeah, absolutely. Absolutely.
Yeah. Well, good deal, Tom. Again, appreciate you taking the time, and we will be in touch.
All right. Thanks. Have a good weekend, Seth.
You too. Well, thank you for turning in. I certainly hope you enjoyed the conversation with Tom as much as I did. It's always an educational experience getting to pick his brain on these topics. Now, if you heard us discussing anything that you have additional questions on, or you feel like your particular case warrants additional inquiry or a consultation, please do not hesitate to reach out to our office. Whether you're a current client or a prospective client, we're happy to sit with you, look at your situation, and see how we can help. Thanks, guys. We'll talk soon.